Okay, so this is what I would do as like an assessment if I suspect someone to have the left hip labral tear and then maybe some left hip SI dysfunction. So first, just for some dedicated palpation and standing, I'm going to kind of go like standing to sitting to supine to prone, try to make it easy for the patient. First, I would come up along his trunk, try to find the iliac crests. There they are. Pull your shirt up for me. And then I would just move my way anteriorly, trying to feel for the PSI. Same here, dude. So then I would try to find, there's this ASIS, and then if you want to turn around, kind of following along that trail of the iliac crest to the PSIS, roughly right there. And then just maybe a quick glute screen to check for any pain, greater troche. Any pain there? Okay. Go ahead and sit down for me. And then I would move into some sitting techniques. So I would do some, just in this case, I would do hip MMT and then maybe some internal external rotation of the hip. To save time, I'll just examine the affected knee, or the affected hip, but I would do it on the unaffected side to kind of establish a baseline. Go ahead and pull this leg up for me. Don't let me pull you. Any pain with that?
Not too bad.
Okay, I give that a 4. And then just a quick internal external rotation. So go ahead and bring this in for me. Don't let me move you. External, say a 4-. Any pain with that? Go ahead and swing it out. And don't let me move you. Internal rotation also a 4-. And before that, I would actually do the quick active range, passive range. So go ahead and swing this leg out. Swing this leg in for me. So roughly 25, go ahead and swing it in. And then about 10, and I can apply some overpressure. Go ahead and keep this thigh relaxed. There we go. Now we're getting up to about 30, and then do a quick internal. And about 25. Okay, go ahead and lay on your back for me. And then just some more palpation I could do. I could come from the ASIS down to the AIIS, or the inferior. Any pain there?
Not too bad.
Not too bad. Okay. Could also do some hip flexion, active range of motion here. So go ahead and bring your knee towards your chest. Any pain with that?
A little bit.
Looking at about. Can you pull it up any further? Okay. So about 85-ish, and then if I add some overpressure for passive, you're getting into like 95. And then moving into some special tests here, we can do, so quick just for the SI dysfunction, we can do the Faber test. And then just push it down. Any pain there?
No, not too bad.
Not too bad. And then just check the other side. Any pain there?
That's fine.
Okay. And then also just some hip special tests for labrum. We do the Fader test. So some flexion, adduction, internal rotation. Any pain there?
Yeah.
Okay. I would expect that because with it being labral tear, might also see some clicking, catching, locking, all those lovely things. And I can also do the grind scour. So I'm really pushing into the ball and socket, giving it a nice turnaround. Any pain there?
Yeah.
Okay. And then go ahead and lay on your right side for me. Just a quick screen for abduction. So I'm gonna bring his leg up and out a little bit. Can you hold that there?
Yep.
Don't let me move you. Say a 4+, the left side. Then go ahead and lay on your stomach for me. And then while I'm here, I can do a quick SI joint mobility test. So just finding the lower lumbar, kind of bouncing off of it. And then I'm on that SI joint, just a nice skin lock. Preferably I would do this, like pull the shorts down a little bit, but just for privacy's sake. and then just assessing for any pain there.
A little, not too bad.
That was what I would expect someone with SI joint dysfunction. And then I can also do another range of motion here. I can do some extension, so go ahead and try to lift this leg up for me as high as you can. Quick. Looking for the, okay. Go ahead. We're getting about 18 degrees. And then, can you hold that there for me? Don't let me move you. And about 4 for the left side for hip extension. Then a quick joint mob I can do for both for assessment and for just a treatment is the army crawl for a PA. So I'm getting him into like the army crawl position as we call it, finding the back of the femur. Ideally I'd get this on a bigger table, and then just applying that, holding down his foot, and then just applying that AP force. I know my body mechanics aren't great, but like I said, I would do it on a lower table. And then for just assessing, pretty hypomobile, which is what you expect with a labral tear. And then for treatment with a grade 4, just those small oscillations through tissue resistance. And see if there's anything else. T joint mobs. Okay. And then looking into and then also that SI joint skin lock, I would also do that for the treatment session as well. And then the last thing, just looking at a left anterior innominate rotation. One treatment that we talk about is using the strap. So I would bring this, a little bit too loose, a little bit too tight. That might be helpful. Yeah, I'd say so. So I bring this up so you can promote some right hip flexion and left hip extension. So actually first I would have him just check for the leg length discrepancy. So go ahead and do a bridge for me. And then bring your legs out. Take my hand. And with it being anterior, I would suspect a little bit of a increase on his left leg. Then go ahead and we'll do the treatment. So go ahead and lie down, and we'll strap you in. Maybe. Okay. And tighten it up. Just make sure. And then I'm going to have him do some hip flexion, and then so basically pull up with this leg and then push out with that leg. So do that for about 5 seconds. Go ahead, hold, 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 relax. Give him a quick breather. Let him catch his breath. Ready for the next one? Go ahead, hold, 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 relax. And then one more, hold, hold, hold. And then just to make sure that the discrepancy is corrected, go ahead and form a bridge again. And then bring his legs out, do another leg discrepancy test. And it's looking a bit more evened out, so that was the successful treatment. So that's kind of my assessment of left labral hip dysfunction, left SI joint dysfunction, and then also kind of a quick innominate rotation treatment.